Hi, everybody. Today I want to talk about media misinformation. There's a story that experts are doubting the models and information presented by the White House. And I've been talking about this for the past 2 days. I think that I've done a much better job of helping people to understand that than what this news article does. So let's talk about misinformation first. I did a video about a week ago called Myth. If I listen to experts, I'll be an expert. And I get into this a little bit deeper. So experts do it, media does it, of course politicians do it all the time too. And the White House would do it too. So why would people misinform us? Well, they want to influence us. They want to get us to behave and do things in a certain way. They want to get a response. Maybe it's so that we vote. Maybe it's so that we practice social distancing. Maybe, some of those reasons may be noble. They may be for our greater good, like the misinformation that was put out by our government relative to N95 breathing masks. We were literally told they don't work, and in fact, they make us less safe, and now we see that message changing. They did that because they believed in their own judgment that it was for the greater good that those masks be available to other people. The amount of additional protection they give us over just doing what we're told to distance was negligible compared to the greater amount of help that they provide for our healthcare workers. So good intent, but still misinformation. Sometimes it's just done to make the message easier to, there's an old saying, don't confuse your customer. Don't confuse your audience. So sometimes you give too much information, you're not speaking to the broad audience. Now, personally, I would prefer that they have forums where they provide the simplified information, but also give you people that want and desire it access to more information. Sometimes it's self-serving. Sometimes it's because the news media wants you to click and they want you to share. They don't care so much if you read their article. It's part of their business model. Political parties, they want you to vote. They want you to go out and vote for their candidate. So there can be self-serving and it can be nefarious. So I think a certain level, when you misinform people, there's always some unintended negative consequences, so it can be hurtful. So how do they do it? Well, selective information. An expert, a media outlet, they pick and choose what information that they're going to provide to you. So you may have 100% verifiable data and facts. You can say, look, the facts. But those facts can be selected in such a way to give a wrong conclusion or an incomplete conclusion. Context. So I give you information, I give you data, I give you facts, but I could provide context around it, especially when you get into technical things or areas that everybody's not completely familiar with. If the context I put around that information influences what the meaning that you take around it. So if I provide information, what is my motivation in doing these videos has always been to try to properly inform people. But there's always biases. We all have our biases. And then there's a narrative. So a little different from context, a narrative is a story that you're telling. So, people, our brains are wired. We're human beings. We're more influenced and we find storytelling more compelling than cold, hard facts. So they can influence you and give you the wrong impression of what the facts mean by telling a story or a narrative around it. And the other way is not to prevent valid perspectives from other experts. There are so I may say, I'm giving you all the information that you want. This is what it means, and this is what you need to do. And in my brain, if I know that there's a counter argument to that, and I know that that counter argument is valid, and I don't provide you with that information, then I'm misinforming you because I'm not giving you that perspective. Or maybe I just tell you, look, other people see this differently. Here's what I think they're saying, and I choose to look at it this way. That because and give you the reasons. So that would be a fair and informative way of helping people to make their own decisions, as opposed to just, selecting information and intentionally not providing alternative views of the situation. So I'll just give you some videos that I have created over the past week that I'll refer back to. So March 25th, myth. If I've listened to experts, I'll be an expert. That digs into this deeper. April 1st, I did a detailed review of the data models presented at the March 31st press briefing. And yesterday I did one that's called Track Progress of COVID-19 Mitigation in Real Time. So, okay, here's what we're talking about. Okay, this happens to be from the Philadelphia Inquirer. They don't have a subscription requirement to read it, but I've seen it in Washington Post. Google it. You'll see it in a lot of outlets. It's basically the same story. So experts and Trump advisors doubt White House's 240,000 corona deaths expert. Okay? Not necessarily untrue, okay? But let's go into the article and, okay, the first two paragraphs, I'm going to show you there's a conflict already between the first two paragraphs. So the first paragraph, and I will read it. Leading disease forecasters whose research the White House used to conclude that 100,000 to 200,000 people will die nationwide from the coronavirus were mystified when they saw the administration's projection this week. The experts said they don't challenge the numbers' validity, but they said they don't know how the White House arrived at them. Now, I would take issue with the word mystified. I would take issue with the whole tone of this thing, because in the first paragraph, they're basically telling you that the experts don't agree, but yet they don't challenge the numbers. So what does that really mean? They refuse to tell how they generated the figure. It's greater than the Vietnam War. Okay, I guess that was important to say. Or 9/11. They have not provided the underlying data so others can, that's not true. So others can assess. Now, there may be some misunderstanding on the part of the media here. Some of Trump's top advisors have expressed doubts about the estimate. So the article talks about Trump doubting, talks about Fauci doubting, and, to me, that's self-evident, okay? When I watched how this unfolded, it's self-evident. Trump put a Easter deadline on this, go back to work. And then we saw a complete reversal of that and a commitment to the 30 days. And what I explained to you in another video is how Trump is seeming sincere in his change of mind. Okay, he listened to the experts. So when a president comes out, or any leader comes out and makes a statement with a deadline like Trump does, and the experts don't agree with that deadline, then obviously there's going to be some disagreement. There's going to be a lot of internal turmoil. I mean, I like the idea that the people that presented this information, the people on this task force, challenge one another, and they go through periods of great disagreement. At some point, a team has to come together and execute on the plan that's chosen. Okay, but if all the experts are in complete agreement and everything on the team, then why do we need them all? You just need one person. Okay, so. Yes, I mean, you talk to insiders, and we got this insider said Fauci disagreed, and Trump was, completely, changed his mind. And then, well, obvious that stuff happened. Obviously, there was behind the scenes, negotiating and trying to influence one another and say, I completely disagree with the idea of doing this deadline. We have this data. Oh, I don't know if I like that data. That's how it works, okay? That's what, good leadership and good experts and good teamwork is all about. So they cite the Columbia University epidemiologist. His own work on the pandemic didn't go far enough to make the future predictions, the White House fatality forecast. He said, we don't have a sense of what's going on in the here and now, and we don't know what people will do in the future. We don't know if the virus is seasonal. Well, okay, but again, I think if you talk to each one of these individuals and ask them to read this story and say, do you agree with the total characterization of what I did? I don't believe they would agree with it. And I think if you got the White House team and this Jeffrey Shaman and these other people that they spoke to and put them together on a panel and let them talk about it, you would see exactly what's going on here. And it's just what he said there, you can say about every single, predictive model. I talk about that. Okay, these are predictive models, and we don't know. That's what a model is trying to do, is help us just predict important things that we really don't know what's going to happen. What is the biggest public issue relative to models? Just being driven by predictive computer models. Climate change. Okay? Now, you can argue about consensus and this and that, okay? But every argument you make against these models' accuracy and lack of knowledge and information that we have, you can say the exact same thing about the climate change models. And people do. People do. I have not seen these news outlets report these other experts and how they challenge. If they do present a climate change expert that questions the models and questions the assumptions, they always present the counter argument to that. And they always weight the counter argument with consensus and larger percentage of agreement and all that sort of thing. They haven't done any of that here. Okay? One of them talks about they have no idea where they got their, quote, model with the big numbers, and they don't know where they got the timeline. Well, I told you yesterday where they got it, but let me just recap, okay? Let me just recap here very quickly. So this, I told you when I first presented this, this is not a model. Okay, this image on the screen here, I call it a visual. Okay, these curves are the standard flatten the curve visual that we've been seeing from the very beginning. It's never been a mathematical model with data behind it, okay? It's a graphic representation. It's a picture to illustrate a concept and an idea. When they say flatten the curve, okay? Everybody says flatten the curve and they feel like they know what they're talking about. That's where this came from, okay? This is a picture of flattening the curve. That's all that this is, okay? They want to show, and I explained this, they want to show the difference between doing nothing, which is the dark, big curve, okay, with a lot of deaths at the top, against the lighter colored, smaller curve. So they're trying to, emphasize how important this is and what can be gained by doing what they're asking us to do. There are numbers on here, and I'll show you where I think at least the 100 to 240,000 numbers came from. But the real point of this picture, it is what it is. It's a picture. And the other graph that they've been showing us, they showed us, and this is why I say that the White House did not select information here, okay? They cited multiple people. They used their data to draw the conclusions that they did. Now, I assume that there was a model these people were all collaborating on. Based on this news story, that is one thing I learned. I believe the White House has consulted with each one of these people, Harvard, Imperial College, whatever, and they're experts in the White House have taken the numbers that they have, that they were provided by these people, and came up with these numbers here. That's what I believe happened, okay? Now, as far as not providing, this is the bottom-up data. This is based on the IHME, and they actually quote this guy in the article, and they do it in such a way that just tries to debunk everything that's been presented, okay? Which I believe is taken out of context, it's incomplete, and it's rather than pick apart at it, I'm just going to recap what I've said about this all along. So if we look at this model, they presented this, and they told us where it came from, and they gave us the daily deaths, and here is the source. Okay, and if we scroll down, right now, they're predicting 93,531 deaths right on this center line here, okay? The peak of this envelope takes it up to nearly 180,000 of deaths. Now, what have I said all along? The visual is to be taken with orders of magnitude, right? We go from apocalypse to tragedy. That's why we want you to do what you're doing, okay? That's what the purpose of this graph is. And so these are actually harder numbers. This is a good model. They talk about, watch the video on it. I explain it all. But we're in the 95,000 to 180,000 range of deaths. Now, you could argue with the bottom of the envelope was 40,000. I assume they assumed that that wasn't helpful. So they go with the consensus estimate of the model, 95 to 180. And then if we look at this one, you're at 100 to 240. Okay, well, there must have been some of the Harvard data or the Imperial College data, whatever. They bumped it up a little bit, okay? But orders of magnitude, that's what we're looking at. And that's all that they were saying, by the way. Every time the reporters tried to question those exact numbers and pick apart 240 and 100, every single time Fauci and Birx backed off of those numbers, okay? Not once did you hear them say, 240,000. We're telling you it's 240. Did you one time hear them say that? No, you didn't, okay? What you heard them was qualify it back. And they weren't like waffling like politicians. What they were trying to do is explain what the numbers are, what a model is, and the fact that it's not precise and we don't know exactly what's going to happen and there's a lot of variables. So basically all the criticism that's being reported today, they were telling you that in the Q&A. Go back and watch it. Okay, so here's an interesting, this is from the FAQ in the IHME model. Okay, one of the questions was, why are your estimates different than those produced by other organizations? Okay, their answer, our model is designed to be a planning tool, okay, which they said, the White House said, and is informed by the shape that other COVID-19 outbreaks are taking in terms of deaths around the world and across the U.S. Okay, so they've looked at numbers of people that have died and so they modeled that, and I imagine they extrapolated from that the number of hospital beds and ventilators and everything that they ICU. Other models may use other approaches, such as assuming a population where everyone is equally likely to interact with everyone else. Okay, we talked about that. The population density. This model takes into account varying population density around the U.S. And our model different scenarios such as the absence of or different levels of social distancing. Okay, so he's talking about these other models, okay? What the White House presented was a visual with big numbers showing you orders of magnitude. Now here's the meat of this FAQ. These models are useful for motivating action to prevent such worst-case scenarios. Okay, while our model is designed to specifically address the planning needs of hospital administrators and governments. Now, they quote the author of the chart in the article, okay? In this news piece, they talked to Christopher Murray. He was cited. My graphic I presented didn't have his name. I couldn't figure out how to get it in the graphic. But Christopher Murray and the IHME were on the chart presented and as a model, okay, as a bottom-up model by the team. Okay, so they quote Christopher Murray that said his model was created for a different purpose from Imperial Colleges. And Imperial College said that we'll go back to that. So the reason we created our model is to help hospitals plan how many beds you'll need, how many ventilators when the peak is likely coming. The purpose of the Imperial's model is to make people realize government intervention is crucial and what would happen without that. So Christopher Murray just affirmed what I read you in the FAQ, that he also said that the Imperial College model was designed to make people realize that government intervention is critical. So it's a motivator. Okay, Imperial College's worst case scenario calculated the toll exacted by the virus over a couple of years. But if the White House's projection covers only the next few months, like the IHME model does, the true death toll will almost certainly be larger because America will probably see additional waves of COVID-19 until a vaccine is deployed. Okay, they talked about the waves. They said this is only the first wave. And they said that we're not sure, what's going to happen as far as the second wave. And I talked about that in my other videos. But so here's my point. Okay, if you watch my videos, I will give you an accurate indication of what was presented by the White House and what are models, what are visual examples. And if you follow this headline, you're completely misinformed. Okay? Reading the articles, yeah, it depends on how good you are at reading between the lines, because the narratives presented around this, okay, the context presented around this information is misleading. Okay? It's misleading to try to undermine what the White House presented. And I believe, okay, if you took every person that was interviewed or cited in this article and you asked them, do you believe that the White House presentation was false? Do you intend to undermine what they presented, why they presented it, and can you tell us what's wrong with it? I don't believe any one of those people would say, no, absolutely. I want to undermine everything. It was completely wrong. What they said is bad for the people. It's completely misleading. That's not what it was, okay? Specific questions, specific comments, okay? But not one of these experts talked about what the totality of what was presented, the total context of what was presented in this news piece. If they said it, the reporters didn't report it. And I don't believe they ever asked those questions. So if you want to know what's really going on, go back and watch my videos over the last 2 days and, learn from this. Learn from this how to protect yourself from misinformation. Now, again, the government does it as well. Another thing, ask those experts if they believe that people should not take social distancing seriously, okay? If their intention of raising their questions and specific detail-y type objections was to say that we're wasting our time social distancing, I don't believe any one of them would say, yeah, we're wasting our time with that. But that's what this news piece happens to do, okay? So I'm not proposing more misinformation to get the proper response out of people. I'm saying full, honest information is still going to get people to do the right thing. And that's what I try to do in my other videos. So if you're reading these stories, take the extra time and watch my other videos. That's all I have today. Be blessed.